Going on? This is Carlos St. Jess, licensed acupuncturist, holistic healthcare provider. Just wanted to leave you with some information today. Sometimes when I grab the microphone, when I grab the video recorder, when I grab my phone and I press record, I wonder, what am I going to talk about? As a healthcare provider, what am I going to talk about? It's been an interesting day. People are feeling better, and I want to keep that trend going. I also want to make sure you can see me. I'm using natural light here. Man, I love the way the sun radiates on my skin. Yeah, how are you doing today? How are we doing? Been a fun day. I deal a lot more with pain management, especially because, one, we're dealing with insurance, and most people are going to come more particularly to see an acupuncturist when there's signs of distress or pain. And as a practitioner, that's one thing. A lot of people, once again, people may think, or someone may think, or have the question or the idea, just because we're on the holistic end of medicine, or we practice integrative healthcare, that we don't use the sciences, or we don't believe in that. Hey, I'm a big fan of labs. You got laboratories, bring them in. You have MRIs and MRI report, bring it in. MRA, a CT, whatever the case may be, bring it in. Let me see it. And records, medical records. I want to know your history. I want to know everything that has happened up to this date, so we can better treat you and find a more tailored treatment option for you specifically. That's the other thing about acupuncture, is that it's individualized. People are going to be coming in with multiple issues. It's like, okay, if two people come in with back pain, yes, the treatments may be similar, but in the end, I'm going to use slightly different points and give them different recommendations based on where they're at in their health, and how severe the injury is, and what they can do, right? So you've heard this idea in terms of having personalized medicine. It may sound fancy. It's very nice. But it is here. It is here today, and you can find it, right? You can find it by just going to an office. I'm here today I'm working in Glendale at the Glendale Adventist outpatient. There's an outpatient facility or outpatient building here that contains a lot of private practices. So I practice here throughout the week, and then I'm in my private practice as well. So I see a wide range and variety of people here in Southern California. Lovely California, I might add. So it's very cool. So, using tests and making sure patients have kind of checked themselves in terms of, you can come to an acupuncturist here in Southern California. We're considered primary care providers, so you can come to an acupuncturist if you have an issue, and I can refer you out as needed. Right? You don't need a referral. Some insurance plans may require that you have a referral, but it's not required legally, right? And so, but if you come in here huffing puffing and you have chest pains and you're thinking you're having a heart attack, I'm going to refer you out to the emergency room. I'm not going to treat you, right? So, as a provider, being aware in terms of what's going on, right? A lot of times when it comes down to pain, I think the common theme for today is pain is treatable, very treatable. And what I do is a lot of times I help people feel better before we even put in the needles. How do you help someone feel better before you put in the needles? And then when you put in the needles, it's like the icing on the cake. It really helps to solidify the treatment. It helps to provide longer term results. and more long-term positive outcomes, we can do that. So how do you do that? You do that through theory. You do that through making sure you have the right diagnosis and making sure you're applying the right treatment. And from my experience and what I've learned and being a provider, I put all these things together and always having the patient's best interests in mind. It's not a cliche. This is not a business thing, right? You see a lot of these commercials out there. They're using now marketing jive buzzwords, right? Cool things. Oh, yeah. No, this is a cool word, right? I know I jive. No, I know. So, they're trying to get you with this idea, but really it is about putting the patients first. And what would you do? That's why I'm always trying to come up with answers for individuals, and trying to find the best treatment option, trying to find the solution to your ailment, to whatever your condition, to help you improve, because I know it's going to help someone else. It may help me in my personal life. It's going to help my patients. It's going to help everyone. It's going to help It's going to help society. It's going to help research and understanding. So I got something on my phone there. Got a little text message. So with that, it's important to understand your theory. It's important to understand what you're doing. I like explaining to the patients what's going on. Have you ever gone to a healthcare provider and then they provide some kind of answer, and it's either so quick or, it's maybe a general answer from the textbook or something like that. I like to help patients know as much as we can know without literally seeing, without an x-ray or any kind of imaging. But when we combine our anatomy and physiology and our Chinese medicine, and we're looking, and when patients are getting better, right, that's my indicator.